ready to dive in. Today we're looking at episode 8 of Significant Talks.
Yeah, this one's all about GLMs.
GLMs.
Generalized Linear Models. They're everywhere in health research these days.
Oh, right, those. I always forget what GLM stands for.
Happens to the best of us. Basically, they're statistical models, help researchers understand, how different things relate to health outcomes.
Like, if certain lifestyle choices are linked to certain diseases, or if, like, a specific treatment actually works.
Exactly. They can tackle all sorts of questions like that, like, does smoking increase your risk of lung cancer? Or is this drug actually effective? Big stuff.
So it's all about analyzing those connections, right? Finding the links between different factors and, well, people's health.
You got it. Now, GLMs, they're built on a few key components.
Okay, break it down for us. What makes these models tick?
First, you've got what's called an association model. Sounds fancy, but it really just describes how those factors, like, say, a patient's age or the kind of treatment they get, are connected to the health outcome we're interested in.
So it's about mapping those relationships, right?
Exactly. Then there's the family of the model.
Family. Like, are we talking about a close-knit group of models here?
Haha, not quite. It's more about the type of outcome you're measuring.
Okay, so, like, different types of outcomes need different types of GLMs.
Precisely. Think of it like this. Some outcomes are yes or no, like whether someone develops a certain disease. That's called a binary outcome.
Right, makes sense.
But then you have things like blood pressure, which is a continuous measurement, or even counts, like how many times a patient has a specific symptom.
So the type of data you're dealing with determines which family of GLM you use.
Exactly. Each family has its own, mathematical approach. Now, the third piece, and this is a big one, is the link function.
Yes. The link function. It's all coming back to me now. This is where it gets really interesting.
Right. This function basically tells us how strong the relationship is between the factors we're studying and the health outcome.
Okay, can we get a real-world example here? Help me wrap my head around this.
Sure. Imagine researchers are looking at data from an ICU, an intensive care unit. They want to know if the type of admission, like whether it's an emergency or an elective admission, affects a patient's chances of survival.
I'm guessing emergency admissions might be a bit riskier just because the situations are often more, well, urgent.
You'd think so, right. And actually, Dr. Al-Kimi in his podcast shows a chart. Emergency admissions do have higher odds of death compared to elective admissions.
Wait, so the GLM can actually calculate those odds? Like, tell us exactly how much riskier an emergency admission is?
Yep. In that case, the model calculated that emergency admissions had a 9.2 times higher odds of death, a pretty stark difference.
Wow, that's pretty powerful. It really shows how these models can uncover some hidden truths in the data.
They really can, but there's a catch.
There's always a catch.
Well, it's not really a catch, but, you gotta be careful.
Wait.
Well, what if there are other factors at play that could be influencing those outcomes, things the model isn't considering?
Right. Like other variables that could be skewing the results.
Exactly. And that's where the concept of confounding factors comes in. It's something researchers have to be really aware of when they're using GLMs.
Confounding factors. Tell me more.
So imagine researchers are testing a new drug for epilepsy. They want to see if it's better than a placebo at reducing seizures.
Makes sense.
But even before the study starts, some patients might naturally have more seizures than others, regardless of the treatment.
Oh, I see. So you're saying their baseline seizure rate could be a confounding factor.
Exactly. Researchers have to adjust for that. If they don't, they might mistakenly attribute the difference in seizure rates to the drug when, in reality, it's just those pre-existing differences.
So how do they adjust for that?
Well, they can actually include that baseline seizure information as a variable right in the GLM.
So it's like adding another piece to the puzzle. The model now considers both the treatment and the patient's initial seizure rate.
You got it. By doing that, the GLM can isolate the effect of the drug itself, separating it from those pre-existing differences.
Clever. So in that epilepsy example, did the drug actually work?
It did. Once they adjusted for those baseline seizure rates, the GLM showed that the new drug reduced the risk of seizures by about 19%.
Wow. That's pretty significant.
Right. And it highlights why it's so important to, carefully consider these confounding factors.
It's like being a detective, making sure you're looking at all the evidence, not just jumping to conclusions.
A very good analogy. And that's just one of the many things researchers need to be mindful of when using GLMs. There's a whole bunch of assumptions they need to check to make sure the model is giving them reliable results.
Okay, this is getting really interesting.
Mhm.
So what are some of those assumptions? What do researchers need to watch out for?
One of the big ones is something called the normality of residuals.
Normality, okay, you're going to have to explain that one.
It basically means that the errors in the model's predictions should follow a specific pattern.
Wait, errors? I thought these models are supposed to be, like, accurate.
No model is perfect, right? There'll always be some variation, but we want to see that those errors or residuals are spread out in a way that makes sense for this type of model.
Okay, so how do you check for that? I mean, is there, like, a special tool or something?
Yep. Researchers use these visual tools like graphs and charts to make sure those errors are behaving as expected. It's a way of, double checking that things aren't totally off.
So it's like a quality control check for the model.
Exactly. Another key assumption is something called homocetisticity.
Homocetus, okay, that one definitely takes the cake for the most intimidating word of the day.
It sounds scarier than it is, I promise. It basically means that the variation in the data should be pretty consistent across different values of the factors we're studying.
I'm a visual person. Can you give me a picture to help me understand that?
Sure, imagine you're looking at a scatter plot of all your data points. Ideally, you want those points to be, spread out fairly evenly. If they're bunched up in some areas and then really thin in others, that could be a red flag.
So it's like looking for a nice, even distribution of data, not all clumped together in weird ways.
You got it. There are statistical tests we can run to make sure everything looks good in that department.
Okay, that makes sense. What else do we need to be on the lookout for?
Another important one, multicollinearity.
Okay, my brain is officially full.
Haha. Don't worry, it's not as complicated as it sounds. It basically means making sure the factors we're studying aren't too closely related to each other.
Why would that be a problem?
Well, if those factors are too intertwined, it can make it really hard to figure out, their individual effects on the outcome.
Can you give me an example?
Let's say you're studying the effects of exercise and diet on weight loss, right? Well, people who exercise a lot also tend to eat healthier diets, so those two factors are connected. If you don't take that into account, it can really muddy the waters.
Right, it'd be hard to tease apart which factor was really driving the weight loss, the exercise or the diet, or a combination of both.
Exactly. And there's a tool called the variance inflation factor, or VIF, that can help us spot that kind of issue.
So the VIF is like a red flag for multicollinearity.
Pretty much. It tells us if we need to maybe rethink how we're approaching the analysis.
Gotcha. Now, what about those outliers we talked about earlier?
Yes, outliers. Those pesky data points that are way off from the rest of the crowd.
Aren't outliers usually a good thing? Like if you're an outlier in terms of athletic ability, that means you're exceptional.
True, but in the world of statistics, outliers can sometimes mess things up.
How so?
Well, an outlier can really skew the results of a GLM. It can make it look like there's a strong relationship where there really isn't, or it can mask a true relationship.
So it's like having a really loud off-key singer in a choir. They can throw off the whole harmony.
Perfect analogy. So researchers have to identify those outliers and figure out what to do with them.
Do they just, throw them out?
Sometimes,
Well,
but first they have to figure out why that data point is so different. Is it a genuine outlier, or was there a mistake made when the data was collected?
It's like being a data detective.
Yeah.
You have to investigate those outliers and make sure they're not messing up the whole case.
Exactly. It's all about ensuring that the GLM is running smoothly and giving us reliable insights.
Makes sense. Now, you mentioned earlier that those link functions play a big role in how we interpret the results of a GLM. Can we dig a little deeper into that?
Oh, yeah. Those link functions are key. They're kind of like translators, helping us understand what the model is actually telling us.
Okay, I'm all ears. Remind me again, how do those translators work?
So remember the ICU example? We were looking at whether the type of admission, emergency, or elective was linked to a patient's survival, right?
Yeah, and the GLM calculated that emergency admissions had a 9.2 times higher odds of death.
Right. And that number, that 9.2, is an odds ratio. It comes from using a specific link function called the logit function.
So the logit function is the translator for that type of analysis.
Exactly. It helps us quantify the relationship between those factors, like admission type, and the outcome, which in this case was survival.
Got it. But what if you're not dealing with a yes-no outcome, like survival?
Hmm.
What if you're analyzing something different, like the number of times something happens?
Good question. You might use a different link function then, like the log function, which gives you a rate ratio.
So different link functions for different types of data and different types of outcomes.
Exactly. And each of those measures, like odds ratios and rate ratios, they have their own little quirks and nuances that you need to understand to, you know, interpret the results correctly.
It's like speaking different languages, right? You need the right translator to understand what's being said.
That's a great way to put it. And that's just scratching the surface of what GLMs can do. We've focused on health research here, but these models are incredibly versatile.
Yeah, it sounds like they could be applied to all sorts of fields.
Oh, absolutely. Think about marketing. You could use a GLM to figure out what factors influence people's purchasing decisions, like age, income, or even things like website design.
Or what about environmental science?
Huh.
Couldn't you use a GLM to study the impact of pollution on different species?
Exactly. The possibilities are pretty much endless. Anytime you're trying to understand the relationship between different variables, a GLM could be a useful tool.
That's pretty amazing. It's like having a Swiss Army knife for data analysis.
Yeah, that's a good way to think about it. But like any tool, you have to know how to use it properly, right?
Right. And that's why understanding those key components of GLMs, those association models, family types, link functions, and all those assumptions we talked about, it's so important.
It is. Because if you don't use the model correctly, you could end up with misleading results, and that could have real-world consequences.
Especially in areas like healthcare, where those results could influence treatment decisions or public health policies.
Exactly. So it's all about being informed and using these powerful tools responsibly.
Well said. This deep dive into GLMs has been incredibly enlightening. Thanks so much for sharing your expertise with us today.
It was my pleasure. I love talking about this stuff.
And to our listeners, we hope you've enjoyed this exploration of generalized linear models. Now, armed with this knowledge, you'll be able to look at research studies with a more critical eye.
Exactly. You'll be able to spot those red flags, ask the right questions, and make more informed decisions about the information you encounter.
It's all about empowering ourselves to be savvy consumers of data and research.
Couldn't have said it better myself.
Well, on that note, we're going to wrap things up here. Keep exploring, keep questioning, and keep diving deep into the world of knowledge. We'll see you next time for another fascinating deep dive.